Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. In this video, I'll go through a demonstration of how to use the county health rankings dataset. So I have in previous videos shown you the details of what secondary datasets are used to generate the county health rankings. In this video, my intention is to show you more kind of foundational sort of understanding of where the history comes from and how this developed over the years. So for this portion, what I want to do is show you a peer-reviewed journal article that has been published in this area. So back in 2015 in Population Health Matrix, in the Population Health Metrics, part of the BMC journal series, this paper was published. And so what it showed is that there is a way to conduct a population health checkup. And this was novel when it first came out because before this, there was no systematic approach. Of course, the morbidity and mortality weekly report, this was something that was being published by the Centers for Disease Control. And there were very frequently state level and local level reports of epidemiological happenings. But there was no streamlined way to compare kind of different states, and also more importantly, rank the states against each other. So what I encourage you to do is kind of scroll through this, take a look, and take a look at how these rankings take place. And then also take a look at kind of the history. Like for instance, in 1990, this was one of the milestones. Northwestern National Life Insurance Company sponsored the publication of a report that summarized the health of 50 states in the U.S. And so this was ranked from healthiest to least healthy. This caught the attention of not only the media, but also a lot of people within universities. So this one effort in 1990, led to more development of proposals for creating something at the level of the county. So this is where the idea for the county health rankings were born. And then subsequently, in 2002, the Population Health Institute was established in the University of Wisconsin. And they started looking at, and this is important, looking at where research can be translated into policy and practice. And this is what we really are getting to when we're thinking about how to use county health rankings. This then developed more so from Wisconsin, and then there were some additional methodologies that were created to expand this, and then this has now gone into a kind of annual form where multiple agencies get together and determine this. So what's some of the processes and data sets that are used to derive this? This is something that is derived from not only the Behavioral Risk Factor Surveillance System, but also the American Community Survey and the National Center for Health Statistics. So these are all areas that are combined to create the county health rankings and then generate a z-score and z-statistic. So let me switch over quickly now to taking a look at how you can look in one of the states and then maybe compare counties that you're more interested in trying to determine overall health. Now, a caveat here, you're not able to take these layer measures. I lecture a lot on mapping, GIS. You're not able to take these layers and actually translate them into spatial joins. But you can do so. I've shown tutorials in other lectures where you can go into ArcGIS and do so from that route. But I'm going to show you where you can actually access directly data points within your county and get a quick snapshot of what is going on. So we can take a look at some of these counties um, on the left and the right. And so maybe you can click on Plymouth, and you can quickly see the health outcomes is ranked higher middle range. So Plymouth ranks in the higher range, and then also is ranked in the lower middle range of counties in Massachusetts when it comes to health factors. Um, so the health outcomes, how are they determined? Well, you can look at some of these measures here. One of the advantages of using this dashboard over potentially using ArcGIS is that there's categories, and so these categories are already provided for you. So you can just go in and click on something and take a look at like fair or poor health. You can take a look at the color and compare this to the rest of the state. Massachusetts is interesting to look at because there's not too many different counties here. So you can take a look at Barnstable County now and then compare. And so health outcomes a little bit lower, middle range, but then health factors a little bit higher range. So this then can break down into health outcomes, health factors, clinical care, social and economic factors, physical environment. So very, very, very specific sort of designations by category. And what I really like about this is the empirical nature of this, in that you're seeing concrete percentages and percent change. These are all very important. So if you're able to look at these trends, some of this doesn't have trend data, so temporal data may not be always readily available. But with alcohol impaired driving deaths, you actually have some trend analysis which you can look at further to see if there's actually improvement or decline. So it seems like there was a slight increase in Barnstable County versus looking at the rest of Massachusetts, where which is green, which this stayed stable. So this is a bit alarming, something to maybe take a look at again in 2021, 2022 data. So this is how you would look at temporal and spatial data, and you can kind of switch over the data, the website for this. I'm gonna say this, repeat this: www.countyhealthrankings.org/APP. Again, www.countyhealthrankings.org/APP. So this is where you go for geospatial comparisons if you want to take a quick look and snapshot of your county. I hope this has provided you with not only an overview, but an understanding of how you can effectively use this data. Thank you for listening.